Ano-ano nga ba ang mga benepisyong maaari mong makuha or ma-avail bilang isang senior citizen? Panoorin ang naging panayam kay NCNC Chairperson Attorney Franklin Kihan.
Sino-sino po ba yung kinikilalang senior citizens po ng ating bansa?
May tatlong batas po na nag-define sino ang senior citizens. Republic Act 7432, 9257, and 9994.
Opo.
Ang senior citizen ay ang isang Pilipino na nag-iedad ng 60 years old and above. So yan po yung senior citizen. Well, maybe if we are to imagine sino-sino yung mga Pilipino, it reaches up to yung kasama yung OFW at mga Pilipino na naririto sa Pilipinas. Kailangan ng senior citizens ID. Number one is that you have your birth certificate.
Kailangan
diba?
pa rin.
Kung wala kang birth certificate, Ma'am Cheryl, di yung marriage certificate mo. Kasi doon sa marriage certificate mo, nakasaad doon yung birth certificate mo eh. Minsan kailangan din na yung kung wala kang birth at saka marriage, yung birth certificate ng anak para ma-measure mo kailan ka ba nag-asawa more or less.
Driver's license, acceptable.
Well, driver's license definitely. Bukod sa birth certificate, yung license mo sa drivers, yung mga government-issued IDs also basis. The senior citizens are entitled to 20% discount. But if the business has the activity is vatable, nagbabayad siya ng VAT, may dagdag na discount, yung VAT exempt, yung transaction.
12%.
Yung 12%. So, number one, pag sumakay na ka ng sasakyan, or taxi, or Grab, entitled ka sa 20% discount.
Kumain.
Hotel,
Yes.
hospital, or even this is gory, but if you reach your end, yung lamay may 20% discount din yun. So there's so much that the senior citizens benefit out of the discounts. Siyempre may 5% po yung sa groceries at saka yung sa kuryente, yung 5% is discount on.
Meron po bang free health services po para sa mga senior citizen?
Cheryl, kagagaling ko lang sa PhilHealth ngayon eh. And I'd like to bring the good news. The senior citizens ay binigyan ng 43 billion worth of budget ng ating pamahalaan. 43B for several million senior citizens. So from now on po, libre po ang annual regular medical examination ng senior citizens na babayaran ni PhilHealth.
Okay.
So can you imagine the benefit, Ma'am Cheryl? Marami po sa ating senior citizens na hindi nagpapa-examine, natatakot ng ineksyon, natatakot na wala silang pera, napapanahon na po na ang lahat na seniors malalaman na nila ang katayuan ng pangangatawan nila, yung health condition nila. Dahil kung alam natin yung health condition natin, then we would know how to prevent, and we would even be able to detect earlier kung may sakit tayo. And when that happens, the health system will improve its delivery dahil pagkaalam natin yung kondisyon ng mga senior citizens, alam din natin ano ang nutrition, ano ang ipapakain sa senior citizens, or ano ang kakainin. Pangalawa, ano yung exercise, galing magsimba, magsumba, at magsaya. So all these things, gagawin natin just so lahat na seniors ma-address yung issue ng primary health care. Of course, may importanteng bagay. Yung maintenance medicine po, Ma'am Cheryl, kailangan ng mga senior citizens. May budget po si DOH, yung mga provinces and cities and municipalities, may mga budget for maintenance medicine. If we have a 100% database for for the senior citizens at ipaalam natin sa mga cities at provinces and municipalities. Ito po ang pangangailangan ng senior citizens for maintenance of high blood, etc. Then we would be able to address earlier yung issue. Our country will be healthier. We will have a better quality of life. Naka-release na po ng budget ng DBM. Nasa PhilHealth na po ang budget. So we are working with PhilHealth kasi as I move around, umiikot din kasi ako eh. So I also tell the senior citizens, please avail of the annual regular medical checkup. Nang sa ganon, hindi lang ang physical health, mental health, dental, optical, hearing, etong lahat importante sa isang senior citizen.
Where can they avail it po? Government hospitals lamang po ba ito available? Pwede po ba sa mga private clinics or hospitals?
The assumption is all the seniors must be registered with PhilHealth. Kasi kung hindi ka registered, di mag-register ka pa. It can take time. So, we are asking all the seniors, hinihikayat natin na seniors na mag-register po sa PhilHealth. Kasama na po sa online registration ng National Commission kasi nag-online registration tayo ngayon, Ma'am Cheryl. Dahil wala tayong data. How can we even decide on the data kung wala tayong data? So we are asking all the seniors, please submit your data form online. Hindi po kailangan ng papel.
Okay.
And then together with that, may available din po sa PhilHealth na form na isasubmit sa kanila. So, with that, ang next is dapat doon tayo magpapa-examine sa healthcare provider na accredited ng PhilHealth. So, ang healthcare provider ay magbibigay ng service, babayaran sila ni PhilHealth ng certain amount na considered as the complete set of health examination. Yes, ma'am. The reason is, number one, the data with the municipalities do not contain the fields that we want to have. The fields are, number one, yung personal. The two is yung children. The third is skill sets. Ano yung mamahagi natin sa next generation. Fourth, yung economic condition. And fifth, yung health condition. Pagka alam natin ito, then we'll be able to advocate. And that this is why we're saying dapat governments must be data-driven. Link is www.ncsc.gov.ph www.ncsc.gov.ph. Sa ngayon, ang ipinamamahagi ng DSWD kasi bago pa lang po kasi ang National Commission, Ma'am Cheryl. And so the tasks of helping the seniors was lodged ng DSWD. We are still in the process of transitioning. Kaya nag-aaral kami, nag-online register because when the time comes, medyo madali-dali na lang kung may data kami. But right now, ang namamahagi ang DSWD. Ang unang subsidy is yung 500 a month. Yun yung tinatawag na social pension na pinamimigay sa indigent seniors. Ang indigent po ay may definition. Una, frail. Pangalawa, sickly. Pangatlo, with disability. And finally, yung fourth essential requirement, with no visible means of support. And may condition, dapat walang SSS, GSIS, PIVAW, and all. Yan yung no visible means of support. So yan po ang binibigyan ng 500. Ngayon, after another law was passed, 11916, magiging 1,000 na po ito per month. This is going to be effective ngayong April. And this is still to be distributed by DSWD.
Okay.
So, yun po yung financial benefits for the seniors who are indigent. Meron din pong dagdag yung mga senior citizens na sinasabing binibigyan ng AX, yung seniors under crisis situation. So may allocation po yan ang DSWD. So pag may seniors in crisis. Of course, yung mga death benefits na may 2,000 which is under review dapat kasi tagal na panahon na yung 2,000 per. But
Ibo.
all these things are under review, and with the new agency, the National Commission, we would like to put all this under study so that pagdating ng panahon na maibibigay na yung trabaho ng DSWD sa amin, ready na po kami. In terms of taxes, sa 11916, yung mga negosyo na nag-i-employ ng senior citizens, may 15% tax shield. Makakapag-deduct sila ng 15% sa sahod na binabayad nila sa senior citizens.
Okay. That's good. That's good.
So
to
it's
know.
actually trying to encourage the businesses to employ senior citizens.
Okay, puntahan din naman natin yung 100 years old. Centenarian po ang isang senior citizen. Magkano po na ang matatanggap niya ngayon? 100,000, tama po ba?
100,000 na manggagaling sa national, but there are local governments nagbibigay din ng 100,000, sometimes less. But can you imagine? That's a premium that everyone is encouraged to stay alive until 100 or even. The commission po is really a blessing to this country. This is the first time na ini-integrate yung trabaho for the senior citizens, yung health, yung social welfare, yung productivity component ng senior citizens. Sana po magkaisa tayo, and thank you very much.